Hi, my name is Amber Foreman, and today I'll be conducting an interview with a health professional in hopes to gain insight into her field. Hello, how are you?
I'm good. How are you doing?
I'm fine, thanks. First, I'd like to thank you for allowing me this interview with you. For starters, could you tell me your name and a little bit about yourself?
My name is Keisha Simmons, and I'm originally from Beaumont, Texas.
Oh, that's like closer to Louisiana, right?
Yes.
What made you move to Houston?
I actually moved to Houston in '96 to attend the University of Houston.
Really? And what did you take? You take up at University of Houston?
I actually majored in psychology, and I graduated with a bachelor's in psychology.
Okay. So where do you work now? Then what do you do?
I'm a registered nurse, and I work at MD Anderson Cancer Center in the Texas Medical Center.
Okay. And how long have you worked there?
I worked there for 7 years. 2 years I was a student nurse, and then for 5 years I've been a nurse for 5 years.
And when you were a student nurse, that was while you were in school?
Yes, I was a nursing student and working as a part-time student nurse.
Okay. Is this your dream job?
Yes, actually it is my dream job. I love what I do, so I would consider it my dream job.
The nursing part of the MD Anderson part?
I would say the nursing part. As long as I can be a nurse anywhere, I'm okay with that.
That's interesting. So could you tell me like your specific job title?
I am a clinical nurse, and basically that just means I work with patients directly at the bedside.
Okay. And early in life, did you know that nursing is the profession that you wanted to take up?
No, actually, when I was younger, I thought I wanted to be a chef, and that faded. And then after that, I thought I wanted to be an attorney, but after I shadowed an attorney, I decided I didn't want to do that.
How long did you shadow the attorney?
Maybe I was in high school, so maybe for 6 months.
Oh, really? That's a cool opportunity to have in high school.
Yeah, and I'm glad I did it because that made me realize that's not what I wanted to do.
Okay. Could you briefly describe your formal education as far as degrees and certifications?
I have a bachelor's degree, a Bachelor of Arts degree in psychology, and I also have a Bachelor of Science degree in nursing from Prairie View.
Okay, and your certifications?
I am certified in CPR, and I'm also certified in acute coronary life support, and that's both of those are certifications.
And the acute coronary life support, right? Could you briefly describe what that is?
It's a step above CPR. Most people, what we call lay people or just regular people, have a CPR certification. But in order to work in an ICU setting, you have to have an ACLS certification. And basically what that does is gives you life-saving techniques above and beyond CPR to save someone's life.
Okay. In your field, do you plan on going back to school and furthering your education?
I do possibly later on plan to go back to get a master's of nursing and education.
So you want to teach?
Yes, I might teach. I possibly want to teach at the university level other nursing students.
Oh. And what do you like most about your job and why?
I like the fact that I get to help people, possibly get them well and get them better and get them back home.
So with any job, there's your highs and your lows. So could you explain the least thing that you like about your job?
I don't like that since my patients are critically ill, a lot of the times they don't make it and they pass away. So that's the part that I like the least.
That's understandable. I personally don't know how you do it. So I definitely commend you on that. In any situations, are there like pitfalls or challenges as far as language goes?
Yes. Where I work is an international hospital, so we have lots of patients who speak different languages, so there can be a barrier to communication more than likely.
So with that being said, do you have like interpreters in place or anything that are in place to help you out with that?
Yes, we actually have interpreters that we can call. They may come to the bedside, or we have a two-way phone where we can talk to them and the patient at the same time. And we also have communication boards that we use that have universal things such as hot, cold, that the patients can point out until we talk to an interpreter.
Are there do you know are you fluent or do you know any other languages besides English?
Yes, I know Spanish.
Or do you feel confident and the message that you're trying to convey to your patients, do you think that they're getting through?
I think for the most part, yes. It's hard because if you're dealing with patients or families that are in a critical condition, sometimes it's hard to communicate. But I think that at the end of the day, they most of the time they do understand and get what you're saying.
So you would say that would be the most challenging thing of being able to effectively communicate?
Yes, the emotional state of the patient and family often gets in the way.
Now this is a little different question. Do you think that gender plays a role in how you communicate with others or how well they communicate with you?
Yes, I think because in my field the gender is mostly female, so I think a lot of times that does play a part because females sometimes may be more emotional or maybe not as upfront as males. That's not the case all the time, but sometimes they can affect affect communication.
Yeah, does age have an impact on the on-job communication?
Age, just like gender, I think it does. I think it can because I'm a younger nurse, and sometimes there are older nurses that I may be in charge of, and sometimes they can have an issue with you being in charge of them or telling them some of the things that they have to do for the day. So yeah, I think that plays a big part.
What role would you say that nonverbal cues play in your work environment?
They play a big role because I was telling you about the international patients. Sometimes with some patients, some things that we do in America can be seen as an insult. Like we use our hands a lot, and we may do stop, or if someone interrupts you, you may do this and say hold up. Well, to some of our Iranian patients, that's like a sign of it's a sign of disrespect because they feel like you use your right hand for different things, and you shouldn't use it to, I guess, tell them to stop, or just using your hand sometimes can be an insult to them.
Wow, that's interesting. I would probably get in a lot of trouble. I tend to talk with my hands quite frequently.
Yeah, most people do, but you learn how to talk after a while, how to talk to certain people.
While in school, do you have to like take a class that told you, helped you to understand nonverbal cues, or was it just like something natural that you just kind of picked up?
It was both. In both of my degrees, we had to take classes on communication, and also when you're around a certain culture of people, you kind of learn to pick up what you should and shouldn't do.
Do you have any final thoughts or advice to give?
I think if you're interested in a career in healthcare, I think it's smart to do like I did, to shadow someone. That way you can see if this is something that you really love to do, and whatever you want to do, you have to keep going to do it. I mean, because I've done it, many others have done it, so you just have to keep going and do what you need to do.
Okay, thank you. I'd like to again thank you for taking time out of your busy schedule in order to let me interview you.
No problem, anytime.
Thank you.
You're welcome.